Hi, my name is Mahmoud Hamdi, and today I'll be doing head-to-toe assessment for my patient. So before we start anything, I'm just going to scan the room. So I'm just gonna clean my hands with alcohol gel, and then I'm gonna wipe my stethoscope with alcohol swab. And so before we start anything, today I'll be doing head-to-toe assessment for you. Is it okay for you?
Yes.
Okay. So before we start anything, do you need to use a washroom?
No.
Okay. So can you please state your name and your date of birth?
My name is Ibrahim. My date of birth is February 6, 2001.
Okay, so my patient appears to be at his stated age, and his skin color is even and better than his genetic background. His height and weight are within his normal range for his age. His body parts are equally bilaterally and smooth, and there is no sign of any masses. And he is sitting comfortably on the bed, and his arm relaxed with his arms relaxed. And his facial expression is appropriate for the situation, and he is maintaining eye contact. And can you please walk back and forth? So his base width is equal to shoulder width, and there is a symmetrical foot placement and smooth, even, and well balanced walk. And he has full mobility. No, he has full joint mobility with accurate, smooth, and coordinate movement. And his breathing pattern is normal, silent, autonomic, and there is no sign of distress. His level of consciousness, he is alert and he is aware of what's happening and what's going on. So now I'm gonna move on to the head. So the skull, it looks symmetrical and in proportion to his body size, and there is no. And now I'm gonna palpate the skull. Do you feel any pain?
No.
Pain?
No.
Okay. So the skull is symmetrical and smooth. There is no tenderness. Masses or swelling on the skull, and his palpebral features, nasolabial folds, and his eyelashes are smooth and symmetrical, and his head is in the midline. And now I'm gonna test for his facial structure. I'm gonna test for the cranial nerve 3, cranial nerve 7 facial. Can you please smile? Can you show your teeth? Can you buff your cheeks? Can you lift your eyebrows? Okay. Can you close your eyes tight? Okay, that's good. So his cranial nerve 7 is fully functional. So now I'm gonna move on to the ears. No, I'm gonna move on to the eyes first. So the eyes, the skin is intact, and there is no redness, swelling, or any discharge from the eyes. And his upper eyelid and lower eyelid are completely closed when he closes his eyes, and his eyelashes are evenly distributed along the eyelid margins. Now I'm gonna check for your the conjunctiva. Okay, can you open your eyes? So the conjunctiva is pink in color, and there is a presence of blood vessels, and the sclera is white. So now I'm gonna check for his cranial nerve. No, don't turn off the light. Now I'm gonna check for his cranial nerve 3 oculomotor. So can you open your eyes? Okay, so his pupil size is round and is regular shape and is 3 millimeter. And so now I'm gonna check for consensual and direct light reflex, and it's smooth and it's symmetrical. I mean, it's both sides round and regular. Can you dim the light? All right, thank you. So now I'm gonna check for consensual direct light reflex. So I can see the shine spot both sides on both eyes. It is equally bilaterally. And now I'm gonna check for I'm gonna turn on the light on your eye to see if it's constricted. Okay. So there is a constriction of the of the pupil. And now I'm gonna check for a consensual light reflex. I have one side. Yeah. I'm gonna check for the second side. Okay, so it's So for the cranial nerve 3 is the cranial nerve 3 is fully functional. So now I'm gonna do the accommodation test. Can you please look at the far side? So while he's looking at the far side, I can see the dilation of the pupil. And can you focus on this one? I can see the constriction. So his pupil constrict and dilate. Okay, so now I'm gonna move on to the ears. So the skin of the ears is consistent, where there is no discharge and there is no, and the size and shape is appropriate and it's equally bilaterally. And now I'm gonna palpate for your auricle and tragus. Do you feel any pain?
No.
There's no pain?
No pain.
Alright, over this side.
No.
So the auricle and tragus, they produce no pain. So now I'm gonna do the whisper test. So I'm gonna whisper 3 words, okay? I want you to repeat after me.
Train. Bus. Car.
Okay.
Apple. Juice. Lettuce.
Okay, so so the whisper test is positive. And now I'm gonna move on to the nose and sinuses. So the nose midline is equally and is symmetrical with the body facial structure, and there is no sign of any watery discharge. And now I'm gonna palpate the frontal and the axillary sinus. Do you feel any pain?
No.
So there is no pain or tenderness on the axillary or frontal sinuses. Now I'm gonna palpate. Now I'm gonna inspect your mouth and pharynx. Okay, so the lips are brown in color and there is symmetrical and there's no sign of sweating. Can you open your mouth? Can you show your gum? So the gums are pink in color and there's no bleeding or swelling. Can you show your teeth? The teeth are present and and clean, and they are present, clean, and white in color, and they are evenly spaced, and they are straight. Can you show your tongue? So the tongue is pink in color and it's moisture. Can you lift your tongue? There is no sign of masses on the base of the tongue. So now I'm gonna inspect your. No, don't turn off the light. Oh, can you open your mouth? Also, the hard plate is white in color. Can you stick your tongue out a little bit? And the soft plate is upward removable, and there is a sign of fivula. So now I'm gonna taste for cranial nerve 9 and 10, glossopharyngeal and vagus. I'm gonna use the tongue later. So I'm gonna depress your tongue, and I want you to say ah. Okay. Or can you say ah?
Ah.
So there is a sign of movement of uvula and the soft plate. Okay, so now I'm gonna test for cranial nerve 12, which is hypoglossal. Can you stick your tongue out? So the tongue, the midline is lateral and is lateral and symmetrical, and there is no sign of lateral. The midline is symmetrical and there's no sign of lateral deviation. And can you put it inside? Can you push it against your cheek, your tongue, on the other side? Okay, and I want you to repeat this once after me. Can you say light?
Light.
Tight?
Tight.
Dynamite?
Dynamite.
So the words are clear, and that means the cranial nerve 12 is fully functional. So now I'm gonna move on to the neck. So the neck surface is can you open your t-shirt a little bit? Okay. So the neck surface and the neck skin color is consistent with the facial color. There is no scars, masses, tenderness, or any bruises. And okay, I'm gonna pop it. Are you feeling any pain?
No.
So the accessory muscles are symmetrical bilaterally, and the trachea is in the midline, and the head position is in the midline, and there is no sign of enlargement of thyroid gland. And now I'm gonna test for your Now I'm gonna check your carotid artery, which is right here. Okay. So the carotid artery is no more regular and strong on both sides. Okay, now I want you to shrug your shoulders. Okay, that's good. I want you to turn your head. Okay, that's good. So the cranial nerve 11 hypoglossal is fully functional. Okay, now I'm gonna move on to your upper extremities, which is your arms. I'm gonna inspect your arms. Okay. So the arm skin color is consistent with the facial color, and the temperature. No. For inspection, the skin color is consistent with the facial color, and there is no sign of any scars. There is no sign of any skeletal deformities, and there is no kind of tenderness on the skin. And the temperature is slightly warmer and cooler, and there is no sign of joint inflammation. And the finger color is a little bit light, bright. It's a little bit warmer than the joints, and the nails are slightly curved, round shape, and smooth. And now, okay, can you please stand? So now I'm gonna taste for this range of motion. Okay, I want. Can you put your hand like this? Flexion, extension. Okay, now I'm gonna do your wrist. I want to flex your wrist. Extend. Okay, now I want you to do like this. Okay. Radial deviation, angular deviation. Okay, and I want you to flex your elbow. And then to extend the elbows. Okay, I want you to do pronation and supination like this. Okay, I want you to do adduction for your shoulders. Adduction, and that's abduction, and this is adduction. Okay, I want you to do internal rotation, external rotation. Okay, I want you to shrug your shoulders. You can just shrug your shoulders. Okay, do you feel any pain or upper movement?
No.
Okay, you can have a seat. So there's no pain. There's no so it has full active range of motion. Now I'm gonna check for his radial pause for 1 minute. So his radial pause is 35 for 30 seconds, and 4 times 2, that's gonna be like 70. So his radial pause is regular, normal, and strong, and it's 72 beats per minute. And I'm gonna check this side. So both sides are equally bilaterally. And now I'm gonna move on to your. I'm gonna check your thorax, cardiovascular. And that, can you please have a seat? And take off your t-shirt. Okay, so the skin color is consistent with the facial color. There is no sign of any skeletal deformities, and his chest expansion is symmetrical. And his anteroposterior diameter is 1, and his transverse diameter, his anteroposterior diameter is 1, and transverse diameter is 2. And so there's no kind of scars, lesions, or any tenderness. Also, I'm gonna palpate. Do you feel any pain?
No.
So there's no pain, there's no scars or any masses, and the temperature is slightly warm. The temperature is warm, and the skin is dry. Okay, so now I'm gonna listen to the breath sounds. Okay, so when I say breathe, I want you to breathe in and out. Okay, I'm gonna compare side to side. Okay, breathe. Okay, breathe. 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 So his bronchovesicular sound is high pitched sound, and the vesicular sound is low pitched sound. So now I'm gonna, okay, can you have a seat? Okay, I want you to breathe normally, okay? Okay, so for 30 seconds he has like 8 respiration. So that's like 16 respiration, which is normal, smooth, and silent. So so his respiration is normal, silent, and is 16 per minute. And now I'm gonna listen to the heart sounds. First, I'm gonna start with the aortic valve, which is found on the right second interspace. Then I'm gonna listen to the pulmonary valve, which is found on the left second interspace. And now I'm gonna listen to the tricuspid valve, which is found on the left fifth interspace, and left fifth intercostal space, on the just below the sternal border, which is here. And now I'm gonna listen to the mitral valve, which is found on the left left midclavicular line, and is in the fifth interspace, which is here. Okay, now I'm gonna ask Uded for his apical pause. So his apical pause is 80 beats per minute. And now I want you to lie down. Okay, so the skin is consistent with the facial skin, and there is no scars, and there is no there's no abdomen hair distribution, and there is no tenderness. Do you feel any pain?
No.
Now I'm gonna palpate the bladder. Do you feel any pain?
No.
Okay, now I'm gonna listen to your mouth sounds on the 4 quadrant. So the bowel sound is high pitched sound, and it's gargling sound, and there is no and it's normal. Okay, now I'm gonna listen to your now I'm gonna do your lower extremities. So the skin color is consistent with the facial color, and there's no tenderness there's no inflammation on the joint. And now I'm gonna palpate the joint. Do you feel any pain?
No.
Do you feel any pain?
No.
So the temperature is slightly is cool, and the skin is dry, and there is no tenderness. There's no joint inflammation. And now I want you to do dorsal and plantar flexion. Okay. I want you to move your feet like towards me. That's plantar flexion, and I want you to move your feet towards you. That's dorsal flexion. Okay. And now I'm gonna palpate for the pulse, for the dorsalis. Yeah, for the dorsalis dorsalis pedis pulse, which is found right here, and the posterior tibialis pulse. Okay. So they are both symmetrical on both sides, and it's strong, normal, and there is they're strong, normal, and they're smooth. And that's everything. And now I'm just gonna clean my hands. And that's everything you can put on your t-shirt. Alright, thank you.